Hello and welcome to Real Talk, a show where we talk about what's happened with adolescents in the country. And as you know, we're trying to reflect as we are heading to the road to the regional adolescents. We're getting closer to the road to the regional adolescent health Indaba in 2024. So we're taking a moment to reflect on the progress made so far for the past 3 weeks. The Adolescent Week District Health Indabas, the Adolescent District Health Indaba have been held successfully across 60 districts in all 10 provinces of the country. Today, we're shining a spotlight on the southern province, where we will be discussing the impact of the district Indaba on the adolescent health and future plans. Joining me are two incredible women, and these are Rosemary Masaku, who is the Provincial AIDS Coordinating Advisor, and Southern Province Nurse, who is Joyce Milimo, the Chief Nursing Officer in Southern Province. Welcome to the program, Madam Rosemary. And I am your host today. I'm Helen Zulupiri. So before I get into asking the questions, Madam Joyce Milimo will be joining us later on the show. But right now, Madam Rosemary is in the building, and she'll be able to just tell us a little bit about how it works. Good afternoon, Madam Rosemary. Madam Rosemary, good afternoon. You may unmute your microphone so that we can hear what you're saying. Okay, I think she's having a little bit of technical challenges, but she'll be back. So you just stay tuned. If you have any questions, do feel free to comment, and our able guests, when they're back on, they'll be able to answer those questions that you may have. So just keep on watching the program. So Madam Joyce Milimo is in. Good afternoon, Madam Joyce Milimo.
Good afternoon. Thank you.
So I was just introducing you as we are opening, and for now, I would just like you to just speak a little bit about your work.
Okay, thank you very much. My name is Joyce Mirimo. I am the Chief Nursing Officer for Southern Province. I work at Provincial Health Office here in Choma. My role is to preside over activities related to nursing and midwifery, as well as the nursing education in the province. I thank you.
Okay. Thank you so much for coming to the program. So remember, even as we dive into the questions with the guests, if you are home, you're watching, wherever you're watching from, we ask that you feel free to ask any questions that you may have. Our able guests will be able to answer that for you. So, Mrs. Milimo, what were the key takeaways from the Southern Province District's Adolescent Health Indaba, and how will they inform your work in addressing the pressing adolescent health challenges in the province, including improving access to adolescent-friendly health services?
Okay, the district adolescent health indabas were quite very interesting. It was actually another platform that we got to engage with adolescents in the districts. We had these indabas in Kalomo, Zimba, Monze, Pemba, Choma. Of course, some districts had to co-host with another district. However, we really had a very good time. So many issues came up from the adolescents, and some of the issues that came up were that adolescents are quite very eager to work with us, and they are quite very grateful that we are looking into their plight. The issues such as lack of recreational facilities came up, and they are really looking forward to such facilities. They said that some of them get to engage in all these sexual relationships and substance abuse, alcoholism, and so forth, because they do not have recreational facilities.
Yeah.
So they said that they wanted these facilities, and we were able to engage with the stakeholders there. And then, having had a few people coming from representatives from the local authority, so the local authority will look into that using CDF funds. They will allow us to apply so that we put up some recreational facilities for adolescents. So some of the issues again were that adolescents were able to say that parents do not freely engage with them with the matters related to sexual and reproductive health from home. So on that one also they said their parents do not freely engage them on sexual matters at home. Therefore, there was a gap there, and we had some people from the religious point of view who said that they would engage parents, church members in church, so that they freely discuss sexual and reproductive health matters with their adolescents at home. So again, we were encouraged to inform our adolescents, and we agreed with them there and then that they needed to engage or join various church groups so that those groups will help them grow according to some biblical values and tenets. Also, the adolescents also brought up the issue of being abused at home, sexually abused at home by their guardians or even parents. And that was, of course, not a very good thing. So they also appealed to us to look into that issue. And fortunately, we had the local leadership, such as the councillors, and we also had, for example, in Kalomo, we also had the DAO, District Administrative Officer. So the local councillors said that they were free to be engaged on such issues should any adolescent face such a traumatizing issues from their own home. They were free to engage the area councillor to help out with the talking to the parents concerning the same. Adolescents also appealed for free space for ADH activities, adolescent health activities. They did mention that some of the limitations they were facing was that the adolescent health spaces were not very open all the time. So even if they needed to go there to collect condoms or even family planning commodities, it was not very, very easy because the facilities would be closed. So there and then we agreed that the adolescent health spaces would be open 24/7, at least probably 6 days a week, and there would be a nurse at each adolescent health space to attend to the adolescent health needs, and that would make sure that the commodities such as condoms and family planning commodities would be available in the adolescent health space throughout. So
Okay.
those are some of the things that came out of the District Adolescent Health Indaba. I thank you.
Thank you very much. So remember, even as we go on with the show, if you have any questions, you're free to please ask, and they will be able to be answered for you. So, Madam Joyce, also just so, how can the nurses contribute to addressing the adolescent health challenges, including engaging adolescents in their healthcare and strengthening the capacity of nurses to provide adolescent health services? As they have said, like in your answer, you mentioned them having their own space and so where they can be taught these things. Is this one of the things that you're going to plan to put in place to help the adolescents?
So, Helen, maybe before Madam Joyce comes on board, I need to just add to what she said that I think the district health endeavors presented an opportunity because remember, this is the first time that we're having the district health endeavors. So in the past, the endeavors were held at this provincial level and also at regional level. So I think from what we get around the country for the districts that held the endeavors is that this interaction was an eye-opener, especially for the service providers, in terms of knowing exactly what issues are faced by the adolescents in terms of access to services, the impediments, different challenges that they have had to face. Because you agree with me that ordinarily, I think it's very difficult, even for adults, when they are not happy with a particular service, to express themselves and be able to suggest that which they think will improve the services, or as and when they are not happy with one particular service or the other. So I think from the service provider's point of view and other stakeholders, it was interesting to hear this particular feedback, which ordinarily they wouldn't know in terms of the concerns that the adolescents had. But also for the district that were participating in this engagement for the first time, it was interesting to hear the views from the adolescents. Of course, some of them had the difficulties really on how to bring out certain issues, but ordinarily you would actually be able to understand what they were trying to put across in terms of what the gaps are. So that was really an opportunity for us to be able to begin to think about how best can we be able to address the needs and the challenges that are faced by the adolescents in terms of health. So I think from the organization point of view and having convened adolescent health endeavors at district level for the first time and in a number of districts across the country, we're able to see how best we can be able to engage with the MOH and other stakeholders to improve not only the policies that speak to access to services, but also how we can begin to work with the healthcare providers to make sure that we begin to address these issues and reduce some of the issues that regard complications that come with the health of adolescents. So I thought I should just add on what you're saying. Thank you so much.
Thank you. So I think you have answered the next question, but unless, Madam Joyce, you have any something to top up on talking about some of the strategies that you're trying to put in place in order to help with adolescent health. You're on mute, Madam Joyce.
Are you able to get me?
Yes, please.
Okay, yeah. So we've been trying to work around that to make sure that our adolescent health spaces are accessible to the adolescents. So some of the strategies that we have put across as follows. We have tried to allocate the youthful staff in the adolescent health spaces. Be it a clinician or a nurse, they should be in that age where adolescents would easily come to the facility and would easily share their problems with. So we have also trained the healthcare staff in adolescent health so that they know how to handle adolescents, because adolescents wouldn't want somebody that is a bit very inquisitive, very anxious about a private life and so forth. So we have tried to engage with the healthcare staff to train them, to help them understand the lifestyle which adolescents are living. So we have not only trained healthcare staff, we have also trained community-based volunteers so that they know, they have the skills and the knowledge on how to handle or manage adolescents. So we have also put a facility focal, adolescent health facility focal point persons at each facility that looks into the health of adolescents and ensure that adolescents are attended to as they come to the facility. And apart from that, we have strengthened issues of confidentiality in our staff so that adolescents can build confidence in our staff and be able to share whatever problems they have. And we have actually assured or educated our staff that they don't have to be judgmental to the adolescents. They really have to try by all means to be non-judgmental so that adolescents are able to share their problems fully. Thank you.
Okay, thank you very much. Before we move on, I wanted to welcome Madam Rosemary. Welcome. And because you were not there during the introductions, I'll ask you to say, talk about your works.
Okay. Thank you so much. Good afternoon, followers and listeners, and good afternoon, the audience and the panelists. I'm Rosemary Masako. I'm the Provincial AIDS Coordination Advisor for Southern Province. My
Okay, I think we've lost Rosemary there. While we wait for her to come, I'll just send you a reminder again to say, if you have any questions, do send them the questions, send them through. We have our able guests right now who are able to answer the questions that you may have. So, Madam Joyce, I'll come back to you while we wait for Madam Rosary to come back. What strategies? Oh, she's back.
Basically is to. Sorry, I went off. I don't know whether it's me or it's
Yes, yes,
everyone.
yeah. Yeah, you had gone off a little bit, so you may start your reintroduction.
Yeah, I think it's the internet that is so poor today. Yeah, so what I was saying was I'm the Provincial AIDS Coordination Advisor for Southern Province. I work under National AIDS Council, which is a coordinating body for HIV, STI, and TB. So my role basically in the province is to coordinate HIV and AIDS programs and also to bring on board all stakeholders that are working in HIV so that we are able to effectively coordinate and implement HIV, AIDS, STI, and TB activities. So basically, that's what I do.
Okay, thank you so
Thank you.
much. So we're talking about the Indabas that were recently held, and I wanted to find out what were the key outcomes from the Indabas related to HIV and AIDS, and among the adolescents, and how will they inform your work in addressing the unique challenges in this population, including scaling up the evidence-based interventions and improving access to HIV services.
Thank you. Yeah, the endeavors went well, and I was really glad that the adolescents were able to open up, maybe because there were very few adults. Of course, we had only one counselor, a chief's representative, and a few members of staff from MOH and also the district local authority. Yeah, so the issues that came out of the Indaba were basically mostly centered on HIV and AIDS, teenage pregnancy, and early marriages. So we've realized that in most of these districts where the Indabas were taking place, they have very high teenage pregnancies, and that shows that we have a lot of issues around teenage pregnancy. And they talked about the issues of the underage, especially adolescents that were getting pregnant and were having a lot of complications. And they also talked about the adolescent health places where they were placed, that they were not comfortable to go to the health facilities, but they would rather have also community adolescent health spaces. So I think that was noted and it was taken into consideration. And because we had counselors there, the counselors will also help us in terms of lobbying for these adolescent health spaces to be placed in the communities through CDF. The other challenge that they were facing were peer pressure. They were talking about other colleagues having phones when others don't have, and that was what was leading them to having high sexual behaviors or risk sexual behaviors that were maybe putting them at risk of contracting HIV and also getting pregnant. So I think the other adolescents came up with ideas of how they could resolve this by peer-to-peer interaction, where we have the peer educators going into the community to also help their fellow adolescents understand the importance of education and the importance of them growing before they indulge in sexual behaviors. So they were still advocating for abstinence, condom use, and PrEP. Although PrEP hasn't been really understood, and that is one of the key areas that Ministry of Health will also focus on in terms of looking at these high-risk behaviors. So I think, yeah, it brought in brought out a lot of issues that we need to look into, and maybe in future that will also inform the adolescent health strategy. We already have the adolescent health strategy, but maybe as it is reviewed, those issues, those recommendations can also be taken into consideration. Thank you.
Okay, thank you so much. So I understand you are trying to address these issues by having the adolescent strategy. Any other things that you want to do, and what role do you think the community can play, the community leaders can play to help solve this problem?
So, Ellen, just maybe before she even comes in, just tying into that question that you have asked, is maybe from
Hello,
my
I think there's
experience. Yeah, from your experience, especially for Zimba and Kalomo, or traditional authority that came to the Indabas, and what were some of the sentiments in terms of the challenges as expressed by the Adelen has said. Madam Mirimo, I think you can take it up as Madam Rosemary comes on board.
We can go ahead.
You can respond
okay.
to that.
So we
Madam.
Come again, I can't get you.
I'm saying you can go ahead to respond to what Helen asked in terms of what commitments are coming from the traditional leaders, but also to know whether during the Indabas there were traditional leaders that were on board and what were the sentiments regarding the concerns
okay.
from the adolescents.
Okay, Madam Rosemary is back. I think she'll be able to answer it. Madam Rosemary, can you hear me? Okay, while we're trying to get back with Madam Rosemary, I think we'll have her back very soon. Just a reminder that you have any questions, comments, you can feel free to post them. And if you have any questions, they'll be answered by our guests. Madam Milimo, I will come back to you for now. Okay, Madam Rosemary, can you hear me? Okay, she's still settling. Okay, so Madam Limo, I wanted to find out what strategies that have been effective in engaging adolescents in the healthcare department, and how can the nurses support this engagement, including training and support needs that you feel adolescents may need?
Okay, so we have been engaging with adolescents through training and various orientations in adolescent health and peer education. And we have continuously sensitized them to abstain from unprotected sex, issues of alcoholism, substance abuse, and so forth. We have also been in touch with the certain adolescents that are addicts and we have been working with one of the alcohol rehabilitation centers that we have in Choma to refer some adolescents there. Recently, we have also gotten in touch with the rehabilitation center in Monze at Holy Family, where we shall now be sending those that are addicted, especially with drugs and even just alcohol. So we have also strengthened the outreach activities with the adolescents to sensitize some fellow adolescents in adolescent health, and different kinds of messages have been going across to the adolescents, including messages to do with HIV/AIDS, STI, TB, nutrition, substance abuse, and so forth. So we have engaged with adolescents actually at various levels, and we know that some are not abstaining, or rather they wouldn't manage to abstain from sexual intercourse. In that case, we have always educated them on the use of family planning commodities such as condoms to prevent the transmission of sexually transmitted infections such as HIV. As you know that we are also having a surge in HIV infections in young people now. So we are really doing our best. And the healthcare workers, not only nurses, but the entire workforce of healthcare workers have all been involved in one way or another with the health of adolescents. And this time we have also put everything to do with the health of an adolescent in a system called Smart Care. So at whatever level, in whatever department that an adolescent will find themselves at the health facility, their history and everything else to do with them would be in Smart Care, and every other healthcare worker would be able to access information about the adolescent, and we will be able to give the much needed information regarding their health. Thank you.
Thank you very much. So just before we read the comments, I'll ask Madam Rosemary to answer the question when just the one she was supposed to answer just before she was cut off. Like, what's the role that the community leaders be playing to help us fight what's happening with our adolescents? You may mute your microphone, Madam Rosemary.
Hello.
Yes, we can get you now.
I think yeah, okay, you can get me now, yes? I didn't get the question.
Okay, so I was just taking you back to the question that you were trying to answer just before you were cut off. So, like, what role are the local leaders going to play, yes, concerning the adolescents?
Well, we're looking at the leaders as champions. So we hope that the leaders, our leaders, especially the traditional leaders, would also get involved in coming up with even traditional laws or bylaws that they can be able to come up with to deter sexual abusers, for instance, and also to allow the sexual reproductive health rights and other strategies that are being placed in the communities to be accepted by the community, because sometimes it's the leaders that,
Okay, I think she has dropped off. She's having some network challenges. So I think we may read some comments from our viewers. Okay, so Rebecca Mlenga says it's good that adolescents have been able to point issues that are leading to a high number of teenage pregnancy, because adolescents, girl child, become vulnerable due to the pregnancy, hence their education becomes affected. Thank you, Rebecca. Timothy Siakaziba says, very insightful presentations going on. Thank you, Timothy. Farai Magi Hachinto says, my leader, Mr. Nkota, I have seen you there. You always inspire us, you people. Thank you. Farai, I guess, is following from Kankata Southern Province. Thank you very much. Rebecca says, following closely. Thank you. Christiancy as well says, following from Mazabuka. Thank you very much. Thank you. So that is about our comments. We don't have any questions. So I want to ask another question to you, Madam Joyce. And this is what vision do you have for the future of adolescents in Southern Province?
You know, we want an educated and well-informed adolescent, an adolescent with a sound mind, an adolescent in good health, an adolescent who is able to make very good judgment over their future. So we want adolescents that are free from HIV, from STI, from substance abuse, and so forth. We wouldn't want adolescents that engage in alcohol, adolescents that are very unruly, adolescents. We want responsible adolescents. You know, it's very costly. Us in the health sector, of late, we have faced an increase in the cost of commodities. This is because we are having quite a huge number of adolescents that are implicated into health complications. For example, in maternal and child health, I can tell you that every week we have more than 700 adolescents giving birth or delivering in various hospitals just within the province. And if in any case that we can have 3 or 4 maternal deaths, usually maybe 2 or 1 of them is an adolescent. Okay, so we are very much affected health-wise with this that is happening with adolescents. So we are really having an increase in teenage pregnancy and early marriages. And these are people whose pelvis or reproductive system is not yet mature enough to carry babies. Therefore, the moment we admit such people in the hospital, we begin to look at what commodities do we have in case of this complication, in case of that, what do we do? Do we have all the medications and so forth? Yeah, so we would like, we envision to have responsible adolescents that are well-informed, adolescents with a sound mind, adolescents in good health, adolescents that will hold positions of influence in future, very responsible adolescents. So we are really looking forward to that. But then we are working hard to help our adolescents to get to look after their health and to concentrate on their education as much as possible. So we are just hoping that in this fight against teenage pregnancy, early marriages, we are together with everybody else. And we have seen the support from the community at least. So we envision a healthy adolescent generation. I thank you.
Thank you very much. So we have the adolescent, the Indaba scheduled for next month. What should we expect?
So we, first of all, with this Indaba, we had one last year, a provincial adolescent health Indaba, and we are having one again next month. So the most important thing that we are looking forward is to meet adolescents and to engage with them and to hear from them about the real issues that are really affecting them, what is really getting them to do whatever they are doing, which is not really very good. And at the same time, we expect to get solutions from them because they are the ones that are affected. We also want to see a situation whereby we shall have more stakeholders attending the this Indaba. We want more stakeholders to attend the Indaba, as well as support more adolescents to attend the Indaba, and not only the Southern Indaba, but the regional Indaba also. We also looking forward to having a good number of traditional leaders this time to attend the Indaba. As you know that traditional leaders play a very important role. We want to hear from various chiefdoms how they have
Okay, we have lost Madam Joyce. Madam Rosemary, welcome back.
Thank you. This internet issues.
No, we understand. So, because I've asked Madam Joyce practically everything, and now I'm coming to you back to back. The first question that I have is, what vision do you have in terms of fighting the epidemic amongst the adolescents? What vision do you have for that?
Yeah, so as National AIDS Council, even when you look at the theme for last year and the theme for this year, the focus is still on adolescents because we are seeing very high infections amongst the adolescents. The new infections are among the adolescents. So the Zambia's vision is to end HIV infections and also reduce on the impact of AIDS in the families. And when you look at the poverty issues that we have now with the drought that has caused a lot of havoc, we have also decided that we participate and look at poverty in relation to HIV and see how these two can be handled together. So we are involving, that's why we are actually multi-sectoral, our vision is to have a multi-sectoral response towards HIV. So we consider everyone that is working in the HIV arena to also focus more on adolescents. We have a number of initiatives that are on board. We have the Dreams initiative, and we also have GIZ that supports the districts to have the JIC toolkits, which is also helping in terms of learning. We are also looking at the local authority being involved in managing HIV. As you know, the devolution is there. It has come to stay. Everyone, all the district, most of the district institutions will move to the local authority. So we have helped Chalimbana to come up with a curricula that will be integrating all HIV, AIDS, STI, TB issues within the curricula of the local authority. So when the staff from the local authority go for the first orientation, that it has been embedded in their curricula. So that is our vision, that we embed, we get HIV to be to be integrated in all activities that are happening in the province and in the nation. So for this year, we are focusing on the adolescents so that we can reduce the HIV infection and the impact it has on families. So that is what we are doing. And even as we look at the Global Fund funding mechanism that is also housed in NAC, the focus has also been on adolescents and key populations for this year. So basically, that's our vision as National AIDS Council and as a country, and even as a province. We want to reduce on the numbers of adolescents that are getting infected by ensuring that all stakeholders are integrating adolescent health in their activities.
Okay, thank you very much. So we have the provincial adolescent health Indaba next month. What should we expect? That is, I'm asking you again. You're on mute, madam.
Don't know what we can do.
Okay. Yeah, so for the provincial Indaba, sorry, I thought maybe the vehicle is the one that is making me not to have internet.
Okay.
Yeah, so the provincial Indabas that we have are actually a good platform for our adolescents to get their views to get the views of everyone around. So this will now inform us in terms of what strategies to put in place. So that for me, that is what is key.
Okay. Thank you very much. So before we come to the end of the show, I'll ask Mr. Ntoka, do you have any last words that you would like to say?
Yeah, I just have one follow-up question, last one to Madam Masako. So if, say, the regional Indaba was held today and you have one takeaway to take to the regional Indaba from the district Indabas, what would that issue be? Like one takeaway, one key issue from Southern Province, from the district Indabas?
Yes, Mr. Ntoka.
Yes.
What is the question again?
The question is, if the regional Indaba was held today, what would that one issue that you be your takeaway to the regional Indaba from Southern Province?
Yeah, from Southern Province, I think our concern is the community adolescent health spaces. We want the adolescent health spaces to move or to also expand from the facility level to the community, because the current situation is that we only have adolescent health spaces in the facilities, and the adolescents are not accessing those places because they feel like it's a place for the sick. So if we take it to the community and also include other activities that will help them be busy and deter from and also learn from the other adolescents on how they are managing themselves, we could maybe help the situation. So we want the same model like the way we have the Dreams model, but in the community at a cheaper rate. Thank you.
All right. Thank you so much. Thank you, Helen, for that question. So for me, on behalf of TYP, really is to demonstrate how effectively we are working with the Ministry of Health, and also to appreciate government in terms of just ensuring that they allow this stakeholdership to come in their space to make sure that we provide a passage for these adolescents to be able to have access to services. So as an organization, I think we are also on course to make sure that all the 10 provincial Indaba come next month are held. We hope to make sure that the feedback from the district Indabas and that which we are going to collect in the provincial Indabas is consolidated enough to have a good case as we hold the regional Indaba. For the regional Indaba, you know that is not only the feedback from Zambia, but during the regional Indaba, we are going to have other countries having side events or satellite events, which will culminate into this regional position. So that's the roadmap. I think we are calling on all stakeholders, including the adolescents, to be ready to come to the table when we are hosting the provincial Indabas, as well as those that are coming to the regional Indaba to come with those key issues, so that at that level also we can begin to think strategies that will inform different policy frameworks. So I think that's all I have to say in terms of closing. Thank you so much, Helen.
Thank you so much. And thank you so much for everybody that tuned in, whether you're watching us from Facebook, LinkedIn, or YouTube. We really thank you for tuning in. And we hope you learned one or two things and you are motivated to do something. So let's keep supporting our youths as we also prepare for the Regional Adolescent Health Indaba, which I am definitely looking forward to. I hope everybody's looking forward to. And those that are going to attend, we hope you attend and be able to learn one or two things. This has been the Real Talk Show. We had our guest, Madam Joyce Milimo, who is the Chief Nursing Officer, Southern Province, and Madam Rosemary Masako, who is the Provincial AIDS Coordination Advisor, Southern Province. And my sign language interpreter was Shadrick Chansa. Thank you so much to everyone, and bye-bye.